So nice to meet you guys. So my name is Dr. Talia Marcajani, and I'm a naturopathic doctor. And the topic today is just kind of generally what naturopathic medicine is. I've given a similar talk here before, but maybe you guys didn't see it. It was last year.
Yeah. No.
All right. So naturopathic doctors we have the same amount of training as medical doctors. So we get a 4-year undergrad degree in the sciences, and then we do a 4-year degree in naturopathic medicine. Okay, so we have the 8 years of school that a medical doctor does.
That's a lot.
Yeah. Oh yeah. Yeah. So we have a lot of training, and so really we're kind of comparable to medical doctors rather than homeopathic doctors or acupuncturists or nutritionists. So we're sort of we're similar in the amount of training to medical doctors. All right. And so the definition of what naturopathic medicine is like the really broad definition, is a primary healthcare model. So primary healthcare, right, is like your family doctor. So it's not a specialist or emergency room. It's the person that you make an appointment with and talk to about your general health. So it's a primary healthcare model that blends modern science with traditional natural forms of healing. We believe in treating the whole person, not just the disease, and identifying and treating the root cause of ailments rather than simply suppressing symptoms. So in that definition, there's a lot of stuff, right? So we have the primary healthcare model, so we're like the family doctor of natural medicine, so we're generalists. So some naturopaths will specialize in certain areas of health, like mental health or geriatric health or pediatrics, but we're trained generally. And we blend modern science and traditional and natural forms of healing. So we're very much like medical doctors up until the treatment phase. That's kind of where we differ. So we do the same kind of intake, the same kind of history, and we do the same kind of diagnostics, and we do laboratory work and physical exams. So all of that is pretty similar to the actual conventional model, and then our treatment is where things change.
You look for the cause.
Exactly, yeah. And so, and while we're doing our whole assessment, we're looking for what the cause is. Exactly.
Yes.
Yeah, and we'll talk about that today too. And so, and then, part of what we do as well is treat the whole person. So that's why we spend a lot of time getting information from our patients. We have really long visits. So my visits are from 60 to 90 minutes in length. So I spend a lot of time with people. And because I want to get to know them, I want to get to know all of the different habits that they have in their lives and all the things that determine what their health state is, right? And, so we don't have someone come in who's a, high cholesterol patient. We have someone come in and maybe one of their goals is to bring their cholesterol down or to prevent heart disease, and that's where we look at people, okay? So when we give, so we give treatments that are going to help the whole person and not just treat the one thing, yeah.
Yes.
And then we look at the root cause instead of suppressing symptoms, right? So you think of like a headache. When somebody comes in, they say, I deal with headaches. I get headaches every week or every month, and it's a pain for me, literally and metaphorically. So, I get a lot of headaches. So instead of saying, okay, here's a medicine to get rid of the pain, we ask what could be causing this, right? Like, why are you getting these headaches, right? And then there's a few reasons why someone might get headaches all the time, right? All right, so that's our general definition. And so this is really important because I think this is where we differ from conventional medicine. So it's not that naturopathic doctors don't agree with drugs and surgery. It's that we don't agree with when they're implemented usually. Okay, so we have this this pyramid, and I got this from a naturopath who lives in Montana, so she made this. And it's called the therapeutic order. So it's kind of like a hierarchy. It's like a it's like a kind of checklist for healing somebody, right? So let's say somebody comes in with their headache. So when we're thinking of what to do to treat them, we look at this pyramid. So giving somebody Advil or a migraine medication is kind of up here, right? So synthetic symptom relief, use of drugs to palliate. So palliate just means kind of suppressing symptoms, okay? So what we do is we start with the foundation. So what are you eating? Hello. Are you drinking? Okay, welcome. Come on in. Yeah. So what are you eating? Are you drinking enough water? Are you getting outside? Is your water clean? You know, are your food sources clean? Do you have friends and social environments, right? So those are is the air that you're breathing clean? So those are like the really baseline determinants of health. If those aren't there, then nothing that we prescribe will work, right? If you're drinking water that's contaminated with something, it doesn't matter how much Advil you take, you're not going to feel better, right? Maybe your headache will go away, but you're not going to be better. Exactly.
Yes.
Exactly. And then we kind of move up. So then we do our some of our therapies like acupuncture or homeopathy or botanical medicine, right? So we start actually giving a therapy to help move your body in the direction of health, right? And then, and depending on how much someone's suffering, right? So how sort of weak their system is, we might be a little bit more aggressive with treatment, right? So some people come in, they don't want to take a lot of supplements, but because they're further along the health disease continuum, they might need a bit more intervention, right, to bring them back into balance. And then so physical alignment. So we address the physical alignment, like, you know, how's your posture? Because, you know, if you're kind of hunched, it's hard to breathe, and then you're not able to get the clean air, right, that we need to feel well. Okay? And so after these have been exhausted, if the person's still not feeling better, perhaps their disease state is advanced such that they just need some medication to help themselves feel better, right? So you think of like somebody who's in palliative care for advanced cancer, you give them, you know, pain medication to help them deal with their symptoms, right? It's not ideal, but you want to make somebody comfortable. So that's sort of where we think medication comes in. It's like you've exhausted your options for treating somebody. So maybe this person's been dealing with a headache, we've looked at their diet, everything is great, and they're still getting headaches, then we'll say, okay, you know, let's do some pain relief. You might need Advil, you might need a stronger medication. And then finally, high force interventions are things like surgeries, right? Or really strong drugs. So you're really now being forceful, and you're changing the body in order to manage the disease or manage the symptoms. So it's not that we're against things like drugs and surgery, it's just that, and a lot of people that when they go to their doctor, they're kind of at the stage where they need it, right? So they might be further along the continuum. So it's not that it's bad that you get surgery. You know, people with knee replacements, right? Like your knee it's been degenerated, so you need to get a knee replacement. So it's not that we disagree, but we like to catch things before it gets that bad. If that makes sense. Yeah, so this is it's kind of complicated, this idea, but this is kind of what we see. So we like to establish the foundation of health before we start to look at drugs. Yeah.
This is not recognized by OHIP or
no, it's not recognized by OHIP,
no,
but
it would be too many healthy people.
Exactly.
It's too bad because really,
exactly. This is a real medicine.
It's costing OHIP a lot more money than
well,
but this is the pharma drug wants it.
Yeah, I know.
Well, that's the thing, right? Because these things are much cheaper than these. Like
That's
surgery,
right.
we know how much that costs, right?
And less painful.
Exactly. Yeah,
Yes.
and then the recovery time
It's
being
up
in
to us to you have the choice.
But this is it. That's why
we
you
have
are
the choice.
absolutely an angel bringing this information to the public. More and more people need to be more aware of
We
it.
have the choice, this or that, you know.
Right. Well, this isn't covered by OHIP, but it's covered by
it's too bad,
health
really.
benefits.
It's too
Covered by what?
Health benefits. So if you have benefits,
If you have insurance, if you don't,
if you have insurance,
Private insurance.
private insurance, yeah.
And that costs too.
Exactly.
Pocket.
And then another thing,
And there's always a limit. They won't
Exactly.
give you more than
exactly, yeah.
X
So it's
number of dollars.
and you can also claim it on your taxes too.
Yeah.
So it's tax deductible.
Okay,
Yeah.
yes, okay,
Yeah.
that's
Which
good.
is a good FYI,
Well,
right?
that's-
yeah. Okay, so
it's up to the people.
some of the things that we're concerned with when I meet with a patient, right? So let's say somebody's coming in with their headache. So I don't just want to know about your headache, and this is why we spend a lot of time with people. This is why we say that we treat the whole person. So the things I'll ask, right, is, and you guys might answer this in your head, is, you know, how are you sleeping? Are you waking up in the middle of the night? How long does it take you to go to sleep? you know, do you wake up and the sheets are scruffled and messed up, right? Which is a sign that sleep was not as restful as it could be. Right. When you wake up in the morning, do you feel like you were rested? That you had a good night's sleep? So we ask all these questions. We get really into these things. How's your energy? And I usually have people score their energy on a scale of 1 to 10. 10 is the best energy you can imagine yourself. You're like bouncing off the walls, and 1 or 0, you can barely wake up. And we score people. A lot of people fall like 6 or 7, right? And we want people at like an 8 or a 9. We want you to feel really good. So, and you know, and a terrible excuse that you'll hear from your doctor is, oh, it's a sign of getting older, which I really hate.
Yeah, get used to it.
Get used to it, yeah.
Over and over.
Exactly.
Age, you think you're getting younger?
Yeah.
Get used to it. Yes.
Well, and you know, a friend of mine was 27 years old and was told he was aging, and that's why he was feeling tired. 27. So I'm like, oh, so if you want to live to 80, 85, you've got a lot of time to get used to being tired and not feeling well. If already at 27 you're showing signs of aging, and that's normal. Right? So we ask about your energy, because energy is a sign that things are working well in your body. If you feel like you're, you know, you have a lot of energy, if you feel like you want to exercise, you want to move, and you want to be a part of things, that's a really good sign. We ask about medications because we want to know, you know, we know that, I mean, some people, we don't just take people off medications. That's not at all what we do. But I want to know, you know, what are you taking? So what's worked before? What have you tried? And some medications cause nutrient deficiencies, right? So things like statins, right? They cause a deficiency in coenzyme Q10, which is an antioxidant vitamin. So if someone's on a statin, then they need to be supplementing, right? So then we also ask about exercise. So how often are you moving? When, where, what's the type of activity? Do you feel pain when you exercise? What are some obstacles to your exercise? And we don't just kind of say exercise. We really, so especially in my practice, I have a course called Motivational Interviewing, which is about really understanding, you know, if somebody doesn't exercise, why that is, right? So instead of just saying, oh, go walk or join a class, we really get into what could the obstacle be for this person, right? Because we all know we should exercise, but not all of us do. So why, right? So we really get into it, and we try and help people make positive changes. I look at diet, so obviously fruits and vegetables, right? A big part of the diet, but what kind of fats? How much protein? You know, how often are you eating? When are you eating? What are you eating in your meals? Do you have an appetite? Do you not have an appetite, right? Are you gaining weight? Are you losing weight? How does your body feel after you eat? Do you feel tired after you eat? Do you feel bloated? Is your digestion off, right? So I ask all these questions to really understand how your body's dealing with life and your lifestyle. And weight, right, is a big one, because, you know, there's many reasons why our weight might slowly creep as we get older, but I like to ask about that too. And is it a goal for you to lose weight? So digestion, and so we talked about, right, getting nutrients from your food and taking vitamins, but if your digestion's not working, then you can't absorb those nutrients, right? So everything begins with your digestion. If your digestion's off, and it's very, very common, about 50%, 40 to 60% of people don't have optimal digestion. So this is a problem, right? Because if I'm giving somebody a vitamin, how do I know that they're absorbing it? They might just be having really expensive pee, right? or bowel movements. So I want to know, do you get heartburn? Do you feel bloated? When you have a bowel movement, is there pieces of food in your stools, right? Because that's a sign that you're not absorbing things. I ask about pain, so where and how long has that been going on for? What does it prevent you from doing? How, you know, on a scale of 1 to 10, how strong is your pain? So, and we kind of differentiate, is it muscle? Is it joint? Is it bone? Is it nerve pain? So we get into pain a lot, right? Because pain is something that we deal with a lot. It's a sign of inflammation a lot of the time. Right? And I always ask about stress. So a lot of you might have had the experience that when you go to your doctor, it's stress. You know, it's just stress. Right. Well, stress is like a whole umbrella for lots of things that could go wrong. And it also takes a lot of effort to manage, right? And so I get into stress with people. So what are your coping mechanisms? What do you do? Some people, watch TV, or they drink alcohol, right? Or they scream and fight, right? So we all have different ways. And some people are pretty good at managing stress. They might go and exercise, or they meditate, right? So there's different ways. There's kind of productive ways of dealing with stress and non-productive ways. And there's also some people that just have a lot of stress in their life, right? It's really common for us to be pretty stressed out, no matter where we are in our life stage. And sometimes that stress is something we can manage, sometimes it's not, right? If we lose a partner, or if something happens in our family that we can't control, it's not really something we have to then build up our resources to deal with it. But sometimes, people work too much, or worry about things that aren't worth worrying about, right? So then we talk about that.
Bills, yes.
Right. Well, things like financial stress, right, is
Yes.
something that it's a very stressful thing, and going to a naturopath might not help because you have to pay for it, right? But yeah, unfortunately.
But if you can't do anything about it, there's no point in worrying about it.
Exactly, right? So sometimes those things aren't
It
really
just comes natural.
exactly.
That's right.
Yeah.
Yeah.
That's right.
So we talk about, how are you managing that stress? Like, how does that stress occur for you? What are the costs on your health? And what can we do about that? So it's a big topic that we spend a lot of time on. And then I ask people, are you taking any supplements or vitamins, right? So some people will try themselves to just go to a health food store and take maybe a multivitamin or some calcium, right? And so I look at what you're taking. Is it a good quality supplement, or is it a waste of your money? Is there something better you can be taking? Are you taking too many things? A lot of time people are taking way too much stuff, right? So I might bring you down, or I might help you choose a better brand, or teach you how to take the supplements you're taking, right? And then I'll recommend my own. Yeah, so these are just some of the topics that we'll address in a consult, right? So we really get into these different topics. In addition to the thing that you're coming in with, because a lot of people are coming in with a specific health concern, right? Knee pain, or headaches, or memory loss, fatigue, right? Okay, so the big part of what we do, which is different from a conventional system, is that we're looking at the root cause. So I already kind of mentioned this and went into this, but we're looking at, you have a tree, but what's underneath? So you have your symptoms, you have your the issues that you're dealing with. Why is that happening? So we're using our science that we've studied for 8 years to understand, why does someone get a headache? What's going on in your veins, in your arteries, at the level of your cells, nutritionally, or what's going on in terms of inflammation? Why are you getting these things? So we ask a lot of questions to try and create a picture of what the roots of the condition look like, right? And we treat this. Oh, you have a deficiency in magnesium, so you get headaches. So we give magnesium, and the headaches go away, right? So we're not kind of chopping down the tree, we're getting it out by its roots, so it doesn't keep coming back. And so, our body's really, really smart. Our body is amazing, and it knows more than we know, probably, because if you think about it, we're using our bodies to learn about the body, so we probably know less than what our body knows, right? Our body's been here longer than us. Our body is 2 million years old, something along that line. Yeah, that's like first humans, right? So I think, our body's got some things figured out to last for 2 million years, and we're struggling with the decades that we have, right? So, for example, one example of this, and really understanding that symptoms are not always things to get rid of, is in a fever. So, one thing that happens a lot in conventional medicine, and this is happily changing, we want this to change, and it is, but one thing that's often done, right, especially with children, if your kid gets a fever, you give them Tylenol, bring down the fever, right? They're sick. But why do we get fevers? Is it just a problem that happens that we need to get rid of, right? Not really. It's our fevers when our body temperature goes up because we have a virus or we have a bacterial infection, and the body temperature goes up to kill those viruses or that bacteria. And as our temperature goes up, our immune system gets stronger too. So having the fever is actually helping us get over the illness more quickly, okay? So it may not be very comfortable. You might be sweating, you might feel sick, but you're sick, right? You've got some kind of infection. And then there's also problems, right? If children get too high a fever, or even adults, if your fever gets to a point that's problematic, then you start to bring it down. But that's a very, very rare thing that happens. Usually our body stays in a certain temperature range that's actually helping us fight the infection better. So when we suppress our fever, we might be actually prolonging the infection, especially with something like Tylenol that doesn't kill the infection. It's just getting rid of the symptom that's helping us kill it, right? So it's a backwards kind of mentality. This is just one example of how symptom suppression is not actually honoring what our body does. And what we believe as naturopaths is that our bodies are always trying to heal themselves. So we have a power to heal, right? You think of your immune system knows what to do when it gets an infection. It fights it off. You get sick, your nose runs, you might throw up, you get a fever, and that's your body fighting it off. So our bodies are always trying to be healthy. And so what naturopathic medicine does is tries to help the body heal. It's already trying to heal itself, and we try and help it heal a little bit more. Maybe we remove an obstacle that's in the way of it healing, or maybe we give some herbs or some supplements that help it work better. But we're not trying to fight it and like bring down a fever or reduce inflammation if we know inflammation is kind of helping us heal. And so another analogy is the dashboard analogy, right? So in your car, and I drive, but I don't have a car, so I don't know. It's a mystery to me. I know about the body, I don't know about machines. And so I borrow my brother's car sometimes, and there's this like light that flashes. It's like bing, bing, and like the car's still working, so I just kind of ignore it. But what would be a really not smart thing for me to do would be to just be like, oh, there's a light flashing, and just smash the dashboard so that the light turns off, right? We know we don't do that with our car. But that's kind of what we do when we suppress fevers, right? Fever is a symptom, something's not right, and it's telling us something, and we were just like, take Tylenol, get rid of it, right? Let's just smash the dashboard. No, instead you figure out if it's a fuel light, you go get more fuel. If it's the air pressure in your tires that's off, then you go and you get more air in your tires. If there's something wrong with the oil, you get the oil changed. You take care of your car. You look at these signals as symptoms that something needs to be done to help your car run better, right? So unfortunately, sometimes we take better care of our cars and machines than ourselves. So we've kind of gone backwards, unfortunately. And so I just wrote some examples of this, right? So, so heart disease prevention is a huge topic. This is where most Canadians die of cardiovascular disease. So preventing cardiovascular disease is very high on priority list for people over the age of 50. So we look at, your diet and your nutrition. So there's a lot of evidence for a Mediterranean diet. Lots of fish, lots of lean meats, good fats like olive oil, lots of vegetables and fruits, okay? Getting lots of exercise, moving, right? Taking a supplement like CoQ10 or fish oil. And something that happens, right, is when you take a cholesterol-lowering medicine, it depletes your CoQ10, which is what actually helps prevent heart disease. So if you're on a statin, then even more is it important to take a CoQ10 supplement. All right, balancing inflammation for pain relief. So I was mentioning that inflammation is a sign of healing, and this is true when you've just injured yourself, right? Maybe you just hurt your knee and it's inflamed. But a lot of us have kind of chronic inflammation, right? These people that get headaches all the time, people with pain all the time, people that just kind of feel unwell. So if there's signs of inflammation, then there's lots of things we can do to find out why. And a lot of it starts with digestion, okay? So, if someone's got a lot of inflammation or a lot of pain, we look at how's your digestion? Are you reacting to certain foods? Do you have a food sensitivity or an allergy? And then we might do some herbs like curcumin, so that's turmeric, or boswellia, which are anti-inflammatories.
What is that, boswellia?
It's an herb.
Oh.
Yeah. Okay. So we'll look at the social determinants of health, right? So what's your social life? Do you have purpose and meaning? What's your economic health, right? Because that's a source of stress we talked about already. What's your lifestyle? What do you kind of do every day when you wake up? What are you eating? What's your mindset? Are you in a good mood most of the time? Do you balance your emotions? Do you have any hobbies? So like all these kind of things that make someone's life meaningful, and that is going to help your health, right? Because mental health is also influences our physical health. All right, we might look at the root cause of fatigue. So you're feeling tired all the time. So it could be a bunch of things. So we look at those things, run some blood work, find out what the cause is. And we understand, right, that health is not just the absence of disease. So just because you took Advil and your headache's gone doesn't mean you're healthy, right? So health is not the absence of disease, but it's the physical, mental, and emotional well-being that we have. So we're striving for that with the people we work with. And then this might be a bit overwhelming for the amount of time we have left, but so in terms of aging, right? Because that's sort of a topic for this center, is looking at specific topics in preventing common things that happen as we age, and ignoring that kind of excuse like, oh, it's aging. You're not supposed to remember anything. You're supposed to be brain foggy. You're supposed to be tired. You're supposed to be in pain. No, we want to look at these things and prevent them, right? Because there's a lot we can do. So, brain health, for example. And I gave a talk a few months ago about that. So looking at, the kind of foods you're eating, balancing inflammation, engaging in new activities, right? All these things that are helping with boosting brain health. Cardiovascular health we talked about. So getting in lots of exercise or movement, eating lots of healthy fats like your coconut oil or fish oil or olive oil, and lots of fruits and vegetables, right? So doing these things that prevent heart disease. Improving sleep, because as we age, we produce less sleep hormone, melatonin. So sometimes we need to supplement, right? Especially if you're not waking up rested. Digestion. So again, digestive enzymes and digestive acid tends to go down as we age. So you guys are doing apple cider vinegar, so that's a good way to bring your stomach acid up to help you digest your food. Mm-hmm. Okay? So that's why you're taking it, and it's a good thing. If you feel like that's helping, then that's a good thing. And especially when people are taking like heartburn medication, right? That requires some supplementation because it depletes some nutrients. So like B12, for example. So that's going to make you feel tired if your B12 is low. And then with fatigue, so that's another common kind of sign of aging or something that will happen just as nutrients start to deplete. So we look at that as naturopaths, and we might recommend some supplements and vitamins to get people's levels up so that their cells can work better.
Excuse me, exactly is the properties of that CoQ10. What is it?
It's an antioxidant. Yeah. So it's a chemical that's in our cells that helps us make energy and detoxify. Yeah. And it's pretty commonly low in people.
Excuse me, sorry to trouble you. What is the mitochondrial health? What is that?
So mitochondria are like our furnaces in our cells. So those are what makes energy for us. It takes our food and it creates energy for our bodies to work. So a lot of the time with fatigue and inflammation, the mitochondria are not working as well as they should. So
what kind of food can give you B12?
So like fish and meat and eggs and those kind of things. Yeah. All right. And then bone health, right? So to take calcium or not, and that'll be my next topic when I come here, is talking about bones and calcium, because I got a lot of questions about that last time. But one really important thing to do for bone health is vitamin D, right? Especially at this time of year, and weight-bearing exercise like walking. Okay, so walking around. And then mental health is another thing that we don't talk about too much when it comes to seniors or even people my age or younger. I work with youth and mental health. That's my kind of special focus. And, you know, there's stress that we don't really acknowledge because it might be financial stress or it might be the stress of losing a spouse, right? Things like that. Loneliness, you know, finding meaning in purpose, right? So they studied populations in the blue zone. So these are people that live the longest in the world. So one place is in Sardinia, Okinawa, right? And they all, exactly, in Japan. And they all wake up every morning with a sense of purpose and meaning for their life. And right, so it's really important. Social activities like coming here is great. So you're all on track for that. And staying active, again. So exercise is a theme here, right? We can't say it enough. Okay, so when you see a naturopath, what kind of happens? Well, so for me, my intakes are 90 minutes, the first visit. And the follow-up visits are about 60 minutes. So we talk about, you know, all the things I mentioned before. Your medications, what are you on, your sleep, your digestion, your chief concern, so what the problem is that you need to see me for, that you want to work on, goals for health, okay? And I might have goals for you and I'll tell you about them. Your energy, I look at your diet diary. So you write down what you eat for 2 weeks. That's fun. And I look at it and give you some advice. You know, are you exercising? What do you do for a living? Or what did you do for a living? Right? This is really important for our health. Family life, etc., etc. So we spend 90 minutes on that. So we get to know each other pretty well by the end of that 90 minutes. I might do a physical exam, listen to your heart, take your blood pressure, and I might ask you to get some blood taken, some laboratory work. So either through a family doctor or through me, okay? And then our treatment is a combination, and it depends on what's going on with you, what your goals are, what needs to be worked on. It depends on what you're willing to do, right? What makes sense for you. So not everyone can change their diet, and not everyone has money for supplements. So we talk about, it's individualized for each person, right? But it might be a combination of diet and lifestyle, supplements, acupuncture. So all naturopaths in Ontario do acupuncture. Counseling. I do a lot of just talking with people, etc., right? So herbs and things like that. And all of these treatments are aimed at treating the roots, okay? So we might do some things to help with symptoms, to help you feel better, just in the short term, but we're looking at treating the root cause, most of all. So that often takes a little bit longer to change, right? So you think about how long you've been dealing with something. It might take half that or, you know, a couple months to really feel better. So patience is a big part of it because we're used to a system where you get a pill and you feel better kind of within the day or two, right? Quick fix, fast food.
The magic pill.
Yeah, exactly. And that's it.